What is the risk of ADEM recurrence for patients? Imagine experiencing a sudden wave of neurological symptoms after an infection or vaccination, often in childhood or adolescence. That's how acute disseminated encephalomyelitis, or ADEM, usually begins. It is typically a one-time event, called a monophasic illness, meaning most people only have one episode. The good news is that the risk of ADEM coming back is generally low. Most patients recover fully within a few months with proper treatment, and they don't experience repeated attacks. However, in a small number of cases, some individuals do experience more than one episode. This is known as multiphasic ADEM. While it still differs from multiple sclerosis, which involves ongoing relapses and progression, multiphasic ADEM indicates that the immune system reacts multiple times, causing new inflammation episodes after the initial recovery. These cases are relatively rare but important to recognize because they can sometimes make it harder to distinguish ADEM from multiple sclerosis. The key difference between ADEM and multiple sclerosis is that multiple sclerosis is a chronic, relapsing disease that often requires ongoing treatment to manage symptoms and prevent new damage. In contrast, most ADEM patients recover completely after their first episode, and long-term treatment is usually not necessary. Still, doctors will monitor patients over time to watch for any new neurological symptoms or changes seen on magnetic resonance imaging scans. If new lesions or attacks appear, it might suggest a different diagnosis, like multiple sclerosis, which needs a different management approach. In summary, the chance of ADEM recurring is low, with most people experiencing only one episode that leads to full recovery. But a small percentage may have multiple episodes, which warrants careful follow-up. It's important to remember that individual experiences vary, and ongoing medical evaluation helps ensure the right diagnosis and treatment. If you or someone you know has had ADEM, staying in touch with healthcare professionals and reporting new symptoms promptly can make a big difference in managing health and understanding the condition better. Always consult a healthcare provider for personalized advice and diagnosis.